So we held two health fairs, one in East LA and one in Northeast LA. And we served over 2,000 people in each of the health fairs. And what we did is we provided free health screenings, vision screenings, dental screenings, consultations with doctors regarding the, a particular problem. We also did blood pressure exams. We had a ton of different services. Another thing we did is that we knew that people have a lot of questions about the Affordable Care Act, what they qualified for, what they don't qualify for. So we had enrollment specialists on site at both of the health fairs. At each one, we enrolled about 100 individuals into Cover California or give them information regarding Medi-Cal expansion or other services that they can get their healthcare needs taken care of. So we've done all sorts of different programs throughout to really be connected to the district. This fair is very important because starting October 1st, the pre-enrollment begins for the new Obamacare system here in California. Right behind me in the gym, to my left, you have information about the Affordable Care Act and how to get enrolled in the new program. If you qualify for Medi-Cal or you qualify for Cover California or any other services that might be provided. So please go to the gym and see what you can sign up for. Thank you so much. Let's give a round of applause to SCIU UHW for doing this. I grew up without health insurance. When I was 7 years old, I got sick with pneumonia and spent 7 days in the hospital. And that 7-day stay almost bankrupted my family because my parents would have to decide, do we spend money on paying down the hospital bills or do we pay the mortgage? And that struggle is something that has influenced the way I kind of see healthcare and how I approach it when it comes to serving the people of the 51st District. So for me, healthcare is a big issue, but it's a personal issue. So one of the things I wanted to do was get more people information regarding healthcare and how to take care of their health through the different events that I've done, my neighborhood district office hours, the 2 health fairs, because that's one of the biggest issues I think people are facing. How do I take care of my family's health and my own personal health? One of the things that we have also done is to raise the issue regarding obesity and diabetes prevention in the Latino community. There's a high rate of high incidence of diabetes in the Latino community, mainly from weight gain. So one of the things we want to emphasize is you have to eat healthy, stay active in order to have a healthy life. It's not just about legislation, but it's about service to the community. I think most elected officials run for office is how do we make things better for people in their communities? How do we give them access to services that they might not have access to? How do we make their life a little bit easier so that they can take care of themselves and their family? So the more we talk to our constituents, the better idea we have on what problems that they're facing, and that we're not reading it from a policy brief, but we're listening to the people that it actually impacts on a daily basis. And that's what I think that we have to do as legislators, have continual contact with our constituents so that we know that when we pass a law, that we understand the personal implications it might have for a particular individual in our district. So politics is not about policy, it's about people.